This is Professor Capron. Welcome to today's lecture on the electrolytes involved in cardiac conduction. Let's take a quick look at our learning objectives for today. By the end of this presentation, you will be able to understand the role of key electrolytes and explain the functions of sodium, potassium, calcium, and magnesium in cardiac conduction. Recognize the impact of electrolyte imbalances and identify how imbalances in these electrolytes can disrupt normal cardiac conduction and lead to arrhythmias, and apply this knowledge to clinical practice by utilizing understanding of electrolytes to assess, diagnose, and manage patients with potential electrolyte-related cardiac issues. These are the key terms that you need to know for this presentation. I'm not going to read them to you, but please do pause and make a note of these definitions. Electrolytes play a fundamental role in maintaining normal cardiac function. Without the proper balance of these critical minerals, the heart's electrical system and overall function can be severely compromised. Electrolytes are minerals in the body that carry an electric charge. They are vital for many bodily functions, including maintaining fluid balance, muscle function, and importantly for this lecture, cardiac function. The heart relies on electrolytes to generate and conduct electrical impulses. These impulses are what trigger the heart to contract and pump blood throughout the body. If the electrolyte levels are off, even slightly, it can lead to serious cardiac issues. Key electrolytes include sodium, potassium, calcium, and magnesium. And each of these electrolytes has a specific role in the heart's electrical conduction system. Sodium is cruciating the electrical impulses in cardiac cells. When the heart cells become depolarized, sodium ions rush into the cells, triggering the action potential that leads to muscle contraction. Potassium is essential for repolarization, which is the process of resetting the heart cells to their resting state after contraction. It helps to stabilize the cell membrane and ensure that the cells are ready for the next contraction. Calcium is necessary for the actual contraction of the heart muscle. It plays a key role during the plateau phase of the action potential, where it facilitates the interaction between actin and myosin, the proteins responsible for muscle contraction. Magnesium helps regulate the movement of sodium, potassium, and calcium in and out of cells. It stabilizes cell membranes and helps to prevent abnormal heart rhythms. The balance of these electrolytes is tightly regulated by the body to maintain normal cardiac conduction. This balance ensures that the heart beats in a regular and coordinated manner. If any of these electrolytes are out of balance, it can lead to arrhythmias, which are abnormal heart rhythms that can range from harmless to life-threatening. For example, hyperkalemia or high potassium levels can cause the heart to slow down and may lead to dangerous arrhythmias such as ventricular fibrillation. Hypokalemia, which is low potassium levels, can cause the heart to beat irregularly and increase the risk of conditions such as atrial fibrillation. Hypercalcemia, high calcium levels, can cause the heart to contract too forcefully and too frequently, potentially leading to hypertension and arrhythmias. Hypocalcemia, which are low calcium levels, can result in weak heart contractions and hypotension. Hypomagnesemia, which is a low magnesium level, can lead to very serious arrhythmias, including dorsade de pointe, a type of ventricular tachycardia. Understanding the roles and the balance of these electrolytes is essential for assessing and managing patients with cardiac issues. Regular monitoring and correction of electrolyte levels can prevent and treat many cardiac conditions, ensuring that the heart functions efficiently. Let's look at the role of sodium in cardiac conduction. Sodium is one of the most important electrolytes in the body, and its role in the heart's electrical system is fundamental to maintaining a healthy rhythmic heartbeat. Sodium is essential for the initiation of the action potential in cardiac cells. An action potential is an electrical signal that travels along the membrane of a cell, such as a neuron or muscle cell, and is crucial for communication and function in many systems of the body. In the heart, the action potential is what triggers the muscle cells to contract and pump blood. The process begins with depolarization, where the normally negative interior of the cell becomes positive. This change in charge is initiated by the rapid influx of sodium ions into the cell. During the depolarization phase, voltage-gated sodium channels open, allowing sodium ions to rush into the cardiac cells. This influx of positively charged sodium ions causes the inside of the cell to become less negative, leading to the rapid rise in the action potential. This rapid depolarization is what generates the electrical impulse that spreads through the heart, triggering contraction. The influx of sodium during depolarization is crucial because it sets off the chain reaction that results in the heart muscle contracting. Without this initial influx of sodium, the heart would not be able to generate the electrical necessary for it to beat. Sodium's role in initiating electrical impulses ensures that the heart beats in a coordinated and rhythmic manner. This coordination is necessary for effective blood pumping. Each heartbeat relies on the precise timing of sodium influx to initiate the depolarization that leads to muscle contraction. An imbalance in sodium levels can significantly impact cardiac conduction. Both hypernatremia, high sodium levels, and hyponatremia, low sodium levels, can lead to serious cardiac issues. Elevated sodium levels can increase the excitability of cardiac cells, leading to enhanced conduction and potentially resulting in tachycardia or other arrhythmias. It can make the cells more likely to fire off electrical impulses prematurely, which can disrupt the normal rhythm of the heart. Low sodium levels can reduce the excitability of cardiac cells, slowing down conduction and potentially leading to bradycardia or other types of arrhythmias. Insufficient sodium can impair the heart's ability to initiate and propagate electrical impulses, leading to weaker contractions and potentially heart failure. Monitoring and managing sodium levels are essential in patients with cardiac conditions. Even small deviations from the normal range can have profound effects on heart function. Healthcare providers must be vigilant in assessing electrolyte levels and intervening appropriately to maintain normal cardiac conduction. Potassium is another essential electrolyte that plays a pivotal role in cardiac conduction. Its function is critical for the heart's electrical stability, the overall rhythm of heartbeats. Potassium is crucial for the process of repolarization in cardiac cells. Repolarization is the phase where the cardiac cells return to their resting state after depolarization, which is necessary for the next cycle of heartbeats to occur. During the influx of sodium ions, which cause depolarization, potassium ions flow out of the cardiac cells. The return of potassium helps to restore the negative charge inside the cell, returning it to its resting state. This return to the resting state is essential for the cell to be ready to depolarize again and maintain a regular heartbeat. Maintaining a proper electrical gradient across cell membranes is one of potassium's roles. The electrical gradient is the difference in charge across the cell membrane, and it is crucial for generating and propagating action potentials. Without a proper gradient, the heart cells cannot effectively conduct electrical impulses, and this can lead to irregular heartbeats. Potassium's movement out of the cells and then its return is what ensures that the heart cells are repolarized and ready for the next contraction. This process must be carefully balanced. Any disruption can have severe consequences for the heart's ability to function properly. An imbalance in potassium levels can lead to dangerous arrhythmias, which are abnormalities in the heart's rhythm. Both hyperkalemia, high potassium levels, and hypokalemia, low potassium levels, can have serious effects. Elevated potassium levels can decrease the resting membrane potential, making it easier for the cells to reach the threshold for depolarization. This can lead to a state of increased excitability and potentially dangerous arrhythmias, such as ventricular fibrillation, where the ventricles quiver instead of contracting properly. If left untreated, this can even lead to asystole, a complete absence of electrical activity in the heart. Think of hyperkalemia as affecting your heart as if it drank way too much coffee and energy drinks. Any stimulation at all can set off an abnormally excitable response. Low potassium levels can increase the resting membrane potential, making it more difficult for the cells to reach the threshold for depolarization. This can slow down the heart's electrical activity, leading to arrhythmias such as atrial fibrillation, where the atria quiver irregularly, or even cardiac arrest if severe enough. So, potassium levels must be carefully monitored, especially in patients with cardiac conditions or those on medications that affect potassium balance, like diuretics. Management includes regular blood tests to monitor levels, dietary adjustments, and medications to correct imbalances. In acute settings, hyperkalemia may require emergency treatment with calcium gluconate to stabilize the heart, insulin and glucose to shift potassium into the cells, and dialysis in severe cases. Hypokalemia is treated with potassium supplements and addressing underlying causes like gastrointestinal losses or increased renal excretion. Understanding the role of potassium in cardiac conduction is critical. It helps to guide interventions to maintain normal cardiac rhythm and prevent life threatening arrhythmias. Proper potassium balance is essential for the heart's ability and overall function. Calcium also plays a crucial role in the heart's ability to contract and pump blood effectively. Calcium is necessary for muscle contraction, and in the context of cardiac conduction, it is particularly important for the contraction of heart muscle cells. This process begins when an action potential reaches the cardiac muscle cells, which triggers an influx of calcium ions. Calcium is involved in the plateau phase of the action potential. The action potential of cardiac muscle cells is different from that of skeletal muscle or neurons because of this plateau phase. After the initial rapid depolarization, where sodium ions rush into the cell, there is a prolonged plateau phase primarily due to the influx of calcium ions through L-type calcium channels. This sustained influx of calcium ions maintains the depolarized state of the cell for a longer duration, which is critical for its function. The influx of calcium during this plateau phase ensures that the heart muscle cells have a strong and sustained contraction. This is essential because the heart needs to pump blood effectively to supply oxygen and nutrients to the entire body. The plateau phase allows for a longer contraction, which is necessary for the efficient ejection of blood from the heart chambers. Calcium also plays a role in excitation contraction coupling. This is the process that translates the electrical stimulus into the mechanical response. When calcium enters the cardiac muscle cells, it triggers the release of additional calcium from the sarcoplasmic reticulum inside the cells. This increase in intracellular calcium concentration leads to the interaction of actin and myosin, the proteins that are responsible for muscle contraction, resulting in the heart muscle contracting. An imbalance in calcium levels can significantly affect the strength and duration of cardiac contractions. Both hypercalcemia, high calcium levels, and hypocalcemia, low calcium levels, can have serious effects on heart function. Elevated calcium levels can lead to increased contractility and a shortened plateau phase, which can result in arrhythmias such as ventricular tachycardia or fibrillation. The increased contractility can also cause the heart to work harder, potentially leading to hypertrophy and heart failure over time if not managed. Low calcium levels can cause a prolonged plateau phase and weaker contractions. This can lead to conditions such as bradycardia, where the heart beats too slowly, and even heart block, where the electrical signal is delayed or blocked entirely. Weak contractions reduce the efficiency of the heart's pumping action, leading to symptoms of heart failure and poor tissue perfusion. Calcium levels must be carefully monitored, especially in patients with cardiac conditions or those on medications that affect calcium balance, such as calcium channel blockers. Management includes regular blood tests to monitor calcium levels, dietary adjustments, and medications to correct imbalances. In acute settings, severe hypocalcemia may require intravenous calcium administration to stabilize cardiac function, while hypercalcemia might be treated with hydration, diuretics, biphosphonates, or dialysis in very severe cases. Understanding the role of calcium in cardiac conduction is vital for maintaining normal cardiac function. Proper calcium balance ensures that the heart can contract strongly and for an appropriate duration, which is essential for effective blood circulation and overall cardiovascular health. Magnesium is a crucial electrolyte involved in maintaining normal cardiac conduction and function. It plays several important roles in the heart's electrical activity and overall stability. Magnesium helps to regulate the movement of both calcium and potassium across cell membranes. This regulation is critical for maintaining the proper function of the cardiac muscle cells and ensuring coordinated contractions. Magnesium acts as a natural calcium antagonist. It helps to control the amount of calcium entering the heart muscle cells during each action potential. By regulating calcium influx, magnesium ensures that the heart muscle contracts appropriately and helps to prevent excessive contraction, which can lead to arrhythmias. Magnesium is also essential for maintaining the proper balance of potassium within the cardiac cells. Potassium plays a key role in repolarization, the phase where the cardiac cells return to their resting state after depolarization. Adequate levels of magnesium help to maintain the normal function of potassium channels, ensuring that the repolarization process occurs smoothly. Magnesium stabilizes cell membranes. By influencing the movement of calcium and potassium, magnesium helps to stabilize the electrical potential of the cardiac cell membranes. This stabilization is crucial for preventing abnormal electrical activity that can lead to arrhythmias. Magnesium's ability to stabilize cell membranes and regulate ion movement prevents the development of abnormal cardiac rhythms such as premature ventricular contractions or PVCs, ventricular tachycardia, and ventricular fibrillation. So, a deficiency in magnesium can have serious consequences for cardiac function. One of the notable conditions associated with magnesium deficiency is torsade de pointes, a specific type of ventricular tachycardia characterized by a twisting of this QRS complex on the ECG. This condition can be life-threatening if not promptly treated. Other arrhythmias can also develop in the context of low magnesium levels, including atrial fibrillation and increased susceptibility to digitalis toxicity in patients taking digoxin. So, monitoring and maintaining adequate magnesium levels is essential in clinical practice, particularly for patients with cardiac conditions. Regular blood tests to assess magnesium levels can help to identify deficiencies early. This is especially important in patients with conditions like heart failure, myocardial infarction, or those on medications that affect electrolyte balance, such as diuretics. In cases of magnesium deficiency, oral or intravenous magnesium supplementation may be necessary to restore normal levels. This can help stabilize cardiac and prevent arrhythmias. For acute situations such as torsade de pointes, intravenous magnesium sulfate is often the treatment of choice to quickly correct the deficiency and stabilize the heart rhythm. Educating patients about the importance of maintaining adequate magnesium levels through diet and, if necessary, supplements is crucial. Foods rich in magnesium include green leafy vegetables, nuts, seeds, whole grains, and fish. Ensuring a balanced intake of these foods can help to maintain healthy magnesium levels and support overall cardiovascular health. Understanding the role of magnesium in cardiac conduction is vital for managing and preventing arrhythmias. Adequate magnesium levels help to regulate the movement of critical ions, stabilize cell membranes, and prevent abnormal heart rhythms, ensuring the heart functions efficiently and balanced electrolytes are essential for the proper functioning of the cardiac conduction system. They ensure that the heart's electrical activity is coordinated and efficient, which is crucial for maintaining effective blood circulation throughout the body. Remember that electrolytes like sodium, potassium, calcium, and magnesium play specific roles in generating and transmitting electrical impulses in the heart. These impulses are necessary for the heart muscle to contract and pump blood. When electrolytes are balanced, the cardiac conduction system operates smoothly, resulting in synchronized and effective heartbeats. So it initiates the action potential in cardiac cells, leading to depolarization and muscle contraction. Proper sodium levels ensure that the action potentials are generated at the correct rate and strength. Potassium is critical for repolarization, the phase where cardiac cells return to their resting state after contraction. Balanced potassium levels maintain the electrical gradient across cell membranes, allowing the heart to relax and prepare for the next contraction. Calcium is necessary for muscle contraction, particularly in the plateau phase of the action potential. Adequate calcium levels ensure that the heart muscle contracts strongly and sustains the contraction for the right amount of time to effectively pump blood. And magnesium regulates the movement of calcium and potassium and stabilizes the cell membranes. So proper magnesium levels prevent abnormal rhythms and support the overall stability of cardiac function. Imbalances in these electrolytes can lead to significant disruptions in the cardiac conduction system. These disruptions can cause various arrhythmias, which can range from mild to life-threatening. Hyperkalemia can cause dangerous arrhythmias like ventricular fibrillation and asystole due to its role in repolarization. Elevated potassium levels can lead to prolonged action potentials and impaired relaxation of the heart muscle. Hypokalemia can result in arrhythmias such as premature ventricular contractions and ventricular tachycardia. Low potassium levels can make the heart more excitable and prone to abnormal electrical activity. Hypercalcemia can cause increased contractility and reduced relaxation of the heart muscle, potentially leading to arrhythmias, while hypocalcemia can result in decreased contractility and a weakened heart muscle, affecting the heart's ability to effectively. And finally, hypomagnesemia can lead to arrhythmias like torsade de pointe and increase susceptibility to other abnormal rhythms. Low magnesium levels can disrupt the regulation of calcium and potassium, leading to instability in the cardiac conduction system. Several factors can contribute to electrolyte imbalances, and understanding these causes is important for both prevention and management. Dehydration can result from inadequate fluid intake, excessive sweating, vomiting, or diarrhea. When the body loses fluids, it also can lose electrolytes, leading to imbalances that can affect cardiac function. The kidneys play a crucial role in regulating electrolyte levels. In kidney disease, the kidneys may not effectively filter and balance electrolytes, leading to abnormalities. Chronic kidney disease and acute kidney injuries are common conditions that can disrupt electrolyte balance. Certain medications can impact electrolyte levels. Diuretics, for example, can cause the body to excrete too much potassium or sodium. Other medications, such as ACE inhibitors, can affect potassium levels. Monitoring and managing medication side effects is important to prevent arrhythmias. Maintaining electrolyte balance is vital in clinical practice, especially for patients with existing cardiac conditions or those at risk of developing arrhythmias. So regular monitoring of electrolyte levels through blood tests is essential. This is particularly important for patients on medications that affect electrolyte balance, those with kidney disease, or those experiencing symptoms of electrolyte imbalances. Treatment involves correcting the imbalance through dietary adjustments, oral or intravenous electrolyte supplements, and modifying medications that may contribute to the imbalance. For acute cases, rapid correction is necessary to stabilize the patient and prevent arrhythmias. Educating patients about the importance of maintaining proper hydration, dietary sources of key electrolytes, and recognizing the signs and symptoms of electrolyte imbalance can empower them to take proactive steps in managing their health. Foods rich in potassium, calcium, magnesium, and yes, even sodium should be included in their diet appropriately. Balanced electrolytes are crucial for the proper functioning of the cardiac conduction system. Imbalances can lead to serious disruptions and arrhythmias. Make sure to understand the causes, recognize the signs, and implement appropriate interventions to maintain cardiac health. Electrolyte imbalances can significantly impact the heart's electrical conduction system and overall cardiac function. Understanding how specific imbalances affect cardiac physiology is crucial for managing and preventing arrhythmias and other cardiac complications. Hypernatremia occurs when there is too much sodium in the blood. This can happen due to dehydration, excessive salt intake, or some medical conditions. High sodium levels can increase the risk of hypertension or high blood pressure by causing fluid retention, which raises blood volume and pressure. Elevated sodium levels can also affect the action potential of cardiac cells. The action potential is the change in voltage across the cell membrane that allows cardiac cells to contract. Hypernatremia can make cardiac cells more excitable, potentially leading to arrhythmias. Hyponatremia occurs when there is too little sodium in the blood. This can result from excessive fluid intake, certain medications, heart failure, or kidney disease. Low sodium levels can lead to decreased extracellular fluid volume, which can reduce blood pressure and perfusion. Hyponatremia can alter the action potential by affecting the electrical charge across cell membranes. This can slow down the conduction of electrical impulses, potentially leading to bradycardia, slow heart rate, or other conduction abnormalities. Hyperkalemia occurs when there is too much potassium in the blood. This can result from kidney failure, certain medications such as potassium-sparing diuretics, or severe tissue damage such as in burns or trauma. High potassium levels can make cardiac cells less excitable, leading to a slower heart rate and, in severe cases, life-threatening arrhythmias like ventricular fibrillation or asystole, which is also called cardiac arrest. On an ECG, hyperkalemia can cause peaked T waves, widened QRS complexes, and flattened looking P waves. These changes indicate a high risk of arrhythmias. Hypokalemia occurs when there is too little potassium in the blood. This can be caused by excessive vomiting or diarrhea, certain diuretics, or inadequate dietary intake. Low potassium levels can make cardiac cells more excitable, increasing the risk of arrhythmias such as premature ventricular contractions or PVCs, ventricular tachycardia, and ventricular fibrillation. On an ECG, hypokalemia can cause flattened T waves, the appearance of U waves, and prolonged QT intervals. These changes indicate an increased risk of arrhythmias. Hypercalcemia occurs when there is too much calcium in the blood. This can result from hyperparathyroidism, certain cancers, or excessive intake of calcium or vitamin D supplements. High calcium levels can increase the strength and duration of cardiac muscle contractions, which can lead to a decreased ability of the heart to relax between beats diastole. This can reduce cardiac output and increase the risk of arrhythmias. On an ECG, hypercalcemia can cause shortened QT intervals and a widened QRS complex. Hypocalcemia occurs when there is too little calcium in the blood. This can result from hypoparathyroidism, vitamin D deficiency, or chronic kidney disease. Low calcium levels can weaken cardiac muscle contractions, leading to decreased cardiac output and hypotension or low blood pressure. It can also increase the excitability of cardiac cells, increasing the risk of arrhythmias. On an ECG, hypocalcemia can cause prolonged QT intervals, which indicates an increased risk of arrhythmias, even up to things like torsade de pointe. Hypomagnesemia occurs when there is too little magnesium in the blood. This can result in alcoholism, malnutrition, certain medications like diuretics, or gastrointestinal losses such as in prolonged vomiting or diarrhea. Low magnesium levels can destabilize cell membranes, leading to increased excitability of cardiac cells and a higher risk of arrhythmias. Hypomagnesemia can interfere with the regulation of calcium and potassium, exacerbating the effects of imbalances in these electrolytes. Clinical hypomagnesemia can lead to arrhythmias such as torsade de pointes, a specific type of polymorphic ventricular tachycardia that can be life-threatening. Recognizing the signs and symptoms of electrolyte imbalances and understanding their impact on cardiac function is crucial for effective patient care. Regular monitoring of electrolyte levels, especially in patients at risk for imbalances, is essential. This includes patients with kidney disease, those on certain medications, and those with conditions like heart failure. Managing electrolyte imbalances involves correcting the underlying cause and restoring the balance of electrolytes through dietary changes, supplements, or medications. In acute settings, intravenous electrolyte replacement may be necessary. It's also important to adjust medications that may contribute to imbalances and monitor the patient's closely. Maintaining a proper balance of electrolytes is critical for ensuring that the heart functions correctly and efficiently. Understanding the clinical implications of electrolyte imbalances is critical for effective patient care. So let's look at what needs to be done in terms of your assessment, diagnosis, and management to ensure patient safety and optimal cardiac function. Regular monitoring of electrolyte levels is essential, especially for patients at high risk. These include patients with kidney disease, heart failure, those on diuretics or other medications that affect electrolyte balance, and those with conditions that cause significant fluid loss, such as severe diarrhea or vomiting. Frequent laboratory tests can help to detect imbalances early before they lead to severe complications. Pay special attention to sodium, potassium, calcium, and magnesium levels. Be vigilant for signs and symptoms of electrolyte imbalances. Muscle weakness and cramps can indicate low potassium or magnesium levels. Severe cases might present with muscle spasms or tetany. Arrhythmias, which are irregular heartbeats, are a major sign of electrolyte imbalance. For example, hyperkalemia, high potassium, can cause life-threatening arrhythmias, while hypocalcemia, low calcium, can prolong the QT interval. And it can predispose to arrhythmias, particularly if it's combined with hypomagnesemia, so you might end up with torsade de pointes. Other symptoms include fatigue, confusion, irritability, and changes in blood pressure. Hypernatremia might present hypertension and edema, while hyponatremia, low sodium, could lead to hypotension and neurological symptoms like seizures. The ECG is a valuable tool for identifying electrolyte imbalances. Remember, hyperkalemia can cause peak T waves, widened QRS complexes, and even absent P waves. Hypokalemia may show flags, U waves might present, and we might have a prolonged QT interval. Hypocalcemia can lead to a prolonged QT interval, while hypercalcemia can shorten it. Magnesium imbalances may present with ECG changes similar to those of calcium imbalances due to its role in regulating calcium and potassium. Always confirm suspected electrolyte imbalances with lab tests. Blood tests measuring levels of sodium, potassium, calcium, and magnesium provide definitive information. For patients with chronic conditions or those on medications that alter electrolyte levels, lab tests should be done regularly for ongoing monitoring. For acute imbalances, IV supplementation might be necessary. For instance, IV potassium is administered for severe hypokalemia, but this must be done carefully to avoid rapid shifts that can be extremely dangerous. Oral supplements are commonly used for less severe imbalances or for maintenance. Potassium, calcium carbonate, and magnesium oxide are typical examples. Dietary adjustments can help to manage and prevent electrolyte imbalances. Encourage foods high in potassium like bananas, oranges, and spinach for patients with low potassium levels. For calcium, recommend dairy products, leafy greens, and fortified foods. Patients with high sodium levels should reduce salt intake and avoid processed foods. For magnesium, recommend nuts, seeds, and whole grains. Medications might need to be adjusted to maintain proper electrolyte levels. For example, diuretics like furosemide can cause potassium loss, so a potassium-sparing diuretic might be used instead, or potassium supplements might be prescribed. Ongoing education about the importance of diet, medication compliance, and regular monitoring is crucial for patients with a history of electrolyte imbalances. Maintaining electrolyte balance is vital for proper cardiac function and overall health. Regular monitoring, recognizing symptoms early, confirming diagnoses with lab tests, and appropriate management strategies are key to preventing complications and ensuring patient safety. Let's do a quick recap of key points on electrolytes and cardiac conduction. Remember, sodium initiates the action potential in cardiac cells during depolarization, and a rapid sodium influx triggers the heart muscle contraction for effective blood pumping. Potassium is vital for repolarization, which resets the cardiac cells after depolarization and ensures the heart is ready for the next beat. Imbalances can cause severe arrhythmias. Calcium is necessary for muscle contraction during the plateau phase of the action potential and ensures strong, efficient heart contractions. Imbalances can affect contraction strength and duration. Magnesium regulates calcium and potassium movement across cell membranes, so it stabilizes cell membranes and prevents abnormal rhythms. Remember that sodium imbalances can disrupt action potentials and affect electrical signal initiation. Potassium imbalances can cause dangerous arrhythmias. Hyperkalemia can lead to peak T waves and widened QRS complexes, while hypokalemia can result in flattened T waves and even the appearance of U waves. Calcium imbalances affect heart muscle contractility. Hypercalcemia shortens the QT interval, while hypocalcemia prolongs it, increasing arrhythmia risk. Magnesium imbalance predisposes patients to arrhythmias, just torsade de pointe. Clinical strategies are important, so regularly monitor electrolyte levels, especially in at-risk patients, and assess for symptoms like muscle weakness, cramps, arrhythmias, fatigue, confusion, and blood pressure changes. Use ECG changes to identify imbalances, and confirm with lab tests for accurate diagnosis and treatment. Administer supplements or medications to correct imbalances, adjust diet and medications to maintain proper levels, and educate patients on maintaining electrolyte balances, recognizing symptoms of imbalance, and adhering to treatments and dietary recommendations. Remember, understanding the role of electrolytes in cardiac conduction and implementing effective strategies can ensure proper cardiac function and patient health. Thank you for paying attention now. Get out of here. Go do some nursey things.